Good evening, Team Wright-Patterson family. We truly appreciate you taking this opportunity to join us tonight in a follow-up town hall that we had last week. Having the opportunity to share information with all of you as we are getting it, and our commitment to give you relevant, actionable information as we can is what we want to make sure that we're doing, and tonight is an example of that. As we all know right now, we are living as history is unfolding in front of us, and these are truly dynamic times. But one of the foundational beliefs that we truly have is that through our strength and belief in each other, we will definitely get through this together. And so again, what I wanted to do was kind of give you an update tonight on some of the efforts that the base has been working and some of the areas that we've been operating on. With that being said, I wanted to make sure that you knew that what we're doing is we are completely tied in with the state of Ohio, our federal and local authorities. We are in constant contact with the Ohio Department of Health, the Center for Disease Control, the Greater Dayton Area Hospital Association. Our teams are also linked in with the State of Ohio Operations Center as we are working with our crisis action teams. And we have got a great tie-in between local and community events. One of the things that we're also very diligently doing is paying attention to the messages that are given to us by President Trump, and we are closely following the messages and directives of Governor DeWine. As we go through this together, one of our major commitments is we want to make sure that we are good partners in this effort. So as we're making changes throughout the step, we are going in lockstep with our local and state authorities so that we can make sure that we are working collectively to combat the COVID-19 virus. As we're doing this, I wanted you all to know that we are in a constant state of evaluation in this base. Our leaders, our teams, our subject matter experts are constantly rallying each day as we're assessing our situation. The status of the base, as we're working for the services that will be provided to our personnel, our hospital operations, our protection, our defense, and our recovery and support functions are all collectively being discussed each day. We've got an amazing group of leaders and a phenomenal team that are truly caring and committed about taking care of the well-being and the health of all of those that call Team Wright-Patterson home. With that being said, we're also working very diligently with our mission commanders. Our mission commanders are retaining the authority to make sure they're determining their level of operations as far as who should be present for work and who should be working in a telework capacity. Because what we want to do is make sure that we're balancing the needs of the United States Air Force and the Department of Defense and ensuring that we're meeting the mission of protecting this great country. But furthermore, what we also want to do is make sure that we're balancing the needs to ensure we're doing appropriate social distancing, that we're making sure that we're utilizing the technology at our disposal to enhance our work abilities as we make sure we're getting after that mission. What I wanted to do tonight is have an opportunity to turn it over to some of our experts. Our experts are going to each give you an update on the areas that we believe are important to all of you. We're then going to follow up with some question and answers, and after we do that, we'll conclude, but we will continue to keep the Facebook Live feed going so that we can answer any of the questions that you're sending us via text or via messaging. I'd like to now hand it over to my 88th Medical Group Commander at this time.
Thank you, sir. Appreciate the opportunity to be here tonight and to join you again on our second Facebook Town Hall live event. I'm Colonel Mike Fouch. I'm the 88th Medical Group Commander, and I'd like to give you a little bit of an update where we are with this situation and also talk to you about some of the changes in services for the 88th Medical Group. So as many of you know and are watching through CDC websites and national media, in the United States there are about 7,700 cases currently positively identified with roughly 97 deaths. Within Ohio, there are 88 cases that have been identified, 8 of which are within about a 30-mile radius of the greater Dayton area, with 1 here in the Dayton area. And so that leads us to what we would call a health protection condition Bravo. That is something that the DoD identifies for health protection conditions on bases. Health protection condition Bravo identifies a confirmed outbreak and a heightened exposure risk for its population. It involves increased community transmissions with more than one in the local area, and from the numbers I've presented, you can see why we're in a health condition Bravo. Your 88th Medical Group team is engaged with the local Greater Dayton Area Hospital Association, in addition to the Ohio Department of Health, the CDC, and our Department of Health and Human Services when it comes to identifying that health risk and the cases in the local area. And we stay connected with them to understand the situation and take the proper preventative measures to keep our population safe. So I know many of you would like to hear about the changes that are going on at the 88th Medical Group. Please understand that we're working through these changes under the premises of the social distancing and the protection of all of our patients and staff that is so vital to our mission. With that in mind, we've implemented controlled access at the Wright-Patterson Medical Center, and we are limiting access for patients and visitors to 2 entrances in the medical group. We've structured visitation guidelines. Whereas before we had a somewhat open visitation policy, we now have very strict guidelines. We have published those to our Facebook page and the Wing base website. That is a place where you can get all of the information that we continue to publish with regard to changes across the base. So with those visitation guidelines and controlled access also comes a screening of our patients as they come to the med group. So what you can expect when you come to the Wright-Pat Medical Center is in 2 entrances, either the main atrium entrance or what we call our MRI entrance. You'll see a team of medical professionals out there to ask you just a few questions for screening before they direct you to the proper care. We've also been able to institute on-site testing for our patients who are deemed, who meet special criteria for being coronavirus tested. Once screened and with a doctor's review and a doctor's recommendation, then we have the capability to move you over to an on-site testing facility. Our Kitty Hawk Pharmacy, with social distancing and wanting to protect all of our patients, our Kitty Hawk Pharmacy has closed its main lobby area as of today. And so that changes part of our pharmacy operation. We are going to enable the drive-through service only at our Kitty Hawk Pharmacy. And we have some requirements and some guidelines for you that we're also posting on the website to explain those changes in our pharmacy operations. We are also reducing routine appointments and increasing our TCON capability. So utilizing secure messaging, calling to do virtual appointments, and we are moving some of our manpower in order to take care of many of those different types of routine teleconference and virtual appointment opportunities. Finally, as the governor has pushed out guidance regarding surgeries, we are reducing and eliminating elective surgeries and elective procedures. If you are someone who may have had an elective procedure, a routine procedure, we will contact you in order to reschedule your appointment. So you should not fear that you're going to show up to the medical group and we've just canceled whatever appointment or procedure or surgery that's coming around. We will contact you. Your provider team will contact you with that information should that come about. As we transition this difficult time and we change our entire operation, I want you to know that the safety and the health of our airmen, our patients, and our staff is paramount in this particular situation. We encourage everyone to exercise the preventative measures provided by the CDC, the Ohio Department of Health, and the governor and his team in order to avoid contracting and spreading this virus. I want you to know your medical team is on point and working very hard to transition our services to make sure that we continue to take care of you and take care of our staff throughout this emergency. I'm going to turn it over now to my comrade, Colonel Paul Berger, who's the Mission Support Group Commander.
Thank you, Mike. As Colonel Fouch said, my name is Colonel Paul Berger. I'm the 88th Mission Support Group Commander here at Wright-Patterson Air Force Base. Now, within my group falls a couple squadrons right now that have pretty direct impact in what's happening right now and a lot of closures that were announced as recently as yesterday. So the first squadron is the 88th Force Support Squadron, and that contains all of the MWR, the morale, welfare, and recreation functions that typically people have come accustomed to on installations. We made the difficult decision yesterday at about noon to curtail probably 90% of the operations within those squadrons as a result of the COVID-19 virus, really in an attempt, as you've heard several times before already, to flatten that curve. Many of these functions were food service operations, and those are currently carry-out only throughout. We're looking at options right now to provide carry-out ability from our club, consolidating some of the food service operations from other facilities that are closed to still maintain some semblance of order and to give individuals the option to get food. In other instances, such as our fitness centers, obviously because of some of the close personal contact that's in there, we did make the decision, and as Colonel Sherman said earlier, kind of in lockstep with the governor, who also shut down similar facilities, to also close the gyms until further notice out of the abundance of caution to prevent the spread of the virus right now. The bottom line to all that is my Force Support Squadron team loves what they do, and this was an extremely difficult decision to shutter these facilities right now. When the time comes, we'll certainly be getting those back up, but again, out of an abundance of caution right now, social distancing seems to be what we need to be cognizant of. Another area that I know is foremost on the minds of many individuals is the status of our child development centers. What I can tell you right now is that the child development centers do remain open. However, we are continuing to evaluate their status. This is the same conundrum that's being experienced by child development centers across the Air Force, while they all wrestle with the same situation of how to provide what's considered a mission essential service, taking care of your sons and daughters against what we need to do to protect them, the workforce, the caregivers, et cetera, from the outbreak. So again, we're continuing to evaluate the situation right now, and as situations develop, we'll certainly pass along additional information. Another squadron that falls under my purview is the Security Forces Squadron, and as Colonel Fouch alluded to earlier, operations have changed in the vicinity of the Kitty Hawk Pharmacy with regard to drive-up only capability there. As a result of that, there are some new traffic patterns, and some of the Security Forces members are out there today assisting that and helping drivers understand what those traffic patterns are. What I would ask of you all is to please be patient, pay attention to the new signs that are out there, and most importantly, pay attention to the directions given by the defenders. They're just trying to keep everybody safe and to keep that traffic flowing through there. The other area where I'd like to extend thanks is to all of you who pass through our gates each and every day. We've gone to what's, for most everyone, a different process, and that's the hands-off ID check. It's been going very, very well. A lot of praise from the defenders, talking with them how the process is going. I would just ask, extend that card out there a little bit farther so that they can clearly see your picture, and to do a good scan of that card to get you onto the installation safely. I'll just wrap up again, getting back to the discussion of kind of flattening the curve. The medics in the end can't do this alone, and it's really incumbent upon all of us to do what we can do to increase that social distance, to give the virus a chance to run its course. So please be patient with us, and I appreciate your understanding when we had to make, again, the difficult decision to close some of the facilities that we love, and I know that you have come to love over the years. So I look forward to taking some questions here during that part of the session. At this point, I'd like to turn it over to the Civilian Personnel Office Chief, Mr. George Braid.
Thank you, Colonel Berger. Again, my name is George Braid. I'm the Civilian Personnel Officer here at Wright-Patterson Air Force Base. I wanted to give you a few updates tonight from topics that are coming up, from telework to leave policies, some due changes, stop movement orders. So I'll address these things quickly one at a time, and then we'll get to the final answers to some of your questions as we go through the Q&A period. So first of all, there's nothing more important to me than the safety and health of our employees on this base. So at daily, we scour OPM, DoD, Air Force regulations and guidelines, looking for updates, updating our commanders and all of our tenant commanders on what's going on, as well as working with our unions and working with our base leadership. I know there's a lot of questions regarding telework usage. Supervisors ultimately have the authority to grant and have flexibilities they can use for telework. Those types of telework flexibilities include ad hoc telework, situational telework, as well as the regular reoccurring telework. So Supervisors have the flexibilities, but mission requirements is really what dictates how we use those flexibilities. When it comes to leave, we have all the leave options available to us, including advanced leave for sick, advanced leave for AL, leave without pay, FMLA, AL. All of those leaves are options, and we will use every flexibility we have to help all of our employees get through those situations that they may be occurring. The final thing on leave I really want to make sure everybody understands is if somebody's requesting annual leave, the supervisors and the commanders have the ability to ask questions about that leave and decide whether it's appropriate time based on mission critical functions at this base. So sometimes people want to use their leave, and it's certainly their leave to use, but we always have to keep in mind mission critical or mission essential functions are what's most important. Recently there was some stop movement guidance given, and we complied with that. That was given on 15 March. This meant there's travel restrictions, and we have stopped all non-mission essential travel and deferred that for the future. So if you hear about TDYs being canceled or anything like that, it's because of this stop order that we received on 15 March. Finally, I just wanted to say a couple things about recruitment and onboarding. We are continuing to recruit, and we will continue to onboard unless it involves PCS orders. If it's PCS orders, then those will be deferred till I think 11 May is the date today, and that date is a fluid date. So we're continuing to recruit, we're still continuing to hire, and we'll continue to in process per our guidance until there's other changes announced. So having said that, I know there'll be a lot of questions tonight, and we'll address any questions that come up with telework and leave throughout this broadcast and afterwards as well. Colonel Sherman?
Great. Thank you, George and team members. I really appreciate the updates tonight. What we'd like to do now is open it up the opportunity to answer the questions that are important to all of you.
Hey, sir, we have a couple of questions on for military members. The first question: some bases have leave restrictions in place for military personnel, such as restricting the distance they can travel from home station while on leave. Does one exist for Wright-Patterson? And if so, what's the distance? And does it apply to civilians?
Okay. I think one of the things we're looking at right now is we kind of deal with the situation in our current operating environment. I really want to kind of stress that. It's our current operating environment as we assess each day based on the unique aspects of our base situation, our local community. What makes this area unique is not only the size and scope of our population, but the distances that they live around Wright-Patterson. At this time, what we're doing is we're encouraging all of our members, all of our family members, all of our teammates here, military and civilian, airmen alike, is that we follow the guidance that has been given to us by our local leaders, our state leaders, and our national leaders on ensuring that we're following proper protocols on social distancing, that we're taking care of ourselves and our family members to prevent exposure. In doing that, we are still vesting an amount of authority on our mission commanders on determining the needs and the best way to operate within leave parameters and constraints that will be enacted by those missions. Should we reach a certain point here at Wright-Patterson where we feel the situation dictates a change, as the installation commander, then it will be my responsibility to make sure that we share that information and enact new guidance that will then place stringent leave restrictions, distance restrictions, and so forth on all of our employees to make sure that we are guaranteeing the maximum ability to combat the COVID-19 virus. With that being said, those things and those decisions are being talked about and discussed on a daily basis. So I just want to make sure that I further foot stomp the importance of that. We are assessing the situation, and if we believe that we need to place those restrictions, we will make sure that that is put out in guidance and shared widely.
Sir, and the second question is, with individuals who have PCS orders and are affected by the stop movement order, what is the current plan to assist those airmen who have already terminated leases or have contracts to sell homes prior to the stop movement being lifted?
So
Will
go ahead. No, go ahead.
Will TLF be paid via government travel card or base housing be an option until PCS is available again?
So I'd like to kind of first answer it general, and then I've got somebody who's going to be able to answer the specifics of it. Of course, this is a very dynamic situation, and we are very closely paying attention to the rules and regulations that have been given to us by the Department of Defense on the stop movement. The most important priority that we have is taking care of our members and their families. our employees and their families are our utmost priority. So whether they are retaining here at Wright-Patterson, whether we are receiving families that are coming from areas that we need to take care and help them shelter, whether we have tech training students that are coming to us after completing their training, we have got teams in place that are set up to make sure we're taking care of them individually. When it comes to the specific of the allowances, I'd like to now turn it over to Lieutenant Colonel Gray. He is our Comptroller Squadron Commander.
Good evening. As Colonel Sherman mentioned, I'm Lieutenant Colonel Steve Gray. I'm the Comptroller Squadron Commander here at the 88th Air Base Wing. So as Colonel Sherman mentioned, it's all about taking care of the airmen. At this time, there is no extension approved for the 10 days of TLE, but I can assure you that all levels are looking at trying to get that extended. Now, it's written in law, and so there's provisions that have to be changed with the law, but we have asked that question. We're asking that question daily, trying to get clarification and hoping for a TLE extension for that situation.
And the next question we have is for civilian personnel.
Hi, I'm Doris Roberts. I'm Chief of Labor and Employee Relations and Civilian Personnel.
Hey, so the question is, can employees be directed to telework?
Yes, there's a couple of situations in which an employee is directed to telework. One is if the agency inactivates the continuity of operations plan, which is also called the COOP, and the employees require the employees to telework if they activate the COOP. The other is if there's a pandemic and the World Health Organization actually orders an evacuation away from the workplace, and DoD components say that they have to go to an alternate location, such as their home, and if an employee already has a telework agreement in place.
And we have a couple other questions that come in, so we'll it's a popular topic.
Okay.
Can an employee telework to care for their children due to school closures?
Yes, that's been a recent change that DoD has actually allowed employees to telework to take care of their children in the event that there is a COOP. And actually, right now we do have employees that are teleworking to take care of their children, and this has been extended through 31 December of 2020.
If an employee is teleworking and the tasks should decrease over time, will it be possible to do a combination of administrative leave and telework? For example, half a day telework or half administration leave?
Yes, that is possible. If the employee finds that they're actually running out of available work because there's a lot of things that are actually hands-on and they have nothing else that they can productively do, they can do the combination of the telework and admin leave, which would be under the health and weather and safety.
For non-appropriated fund or other employees who are not authorized to telework, is there any flexibility to the rule due to unprecedented circumstances?
Yes, the non-appropriated funds employees will actually be under the same similar type of leave.
And if the
is a question that some of the supervisors are actually working on. And again, that's one of these things that's constantly changing as we go through this entire situation.
And finally, if I start to feel sick while I'm teleworking, do I have to take sick leave?
Yes, if you start to feel sick while you're teleworking, you need to contact your supervisor immediately and then change the status of your leave.
We have a couple questions for communications. If an employee is teleworking with a government computer, will they need to occasionally bring it in for updates?
So first off, I'm Jeff Crapo, the Communications Squadron Commander here at Wright-Patterson Air Force Base. So we can push updates and patches over the VPN, but in order for that to work, you have to have a very consistent, strong VPN connection. As we've seen with the large number of teleworkers increasing as we continue down this road, the VPN capability was never built to handle this level of telework, so we're not seeing steady streams of VPN connections. We're continuing to work on that, but in terms of updates and patches, the best solution that I will offer is to schedule with your work centers to intermittently come into the office and plug in your laptop to the LAN and work for a few hours on the LAN. If that doesn't work, or you're not able to do that, then I suggest leaving your laptop connected to the VPN for multiple hours, I'd say about 2 hours, during off-peak times in the evenings or in the on the weekends. During the day, we're asking people to use resources other than the VPN at all possible due to the large amount of folks that are currently on the VPN.
If I don't have access to VPN and I can't get it, what other options are there for me?
So there's OWA, or called Outlook Web Access, which is available from personal computers as well as government computers off of the network. You need a common access card as well as the hardware to be able to read that and to be able to connect to that. You can also connect to SharePoint, which is a file sharing capability. You can access that again with a CAT card off of the network. And the final option is people that have government phones, which are capable of doing secure messaging. And if you believe that you are in need of that for your position, then you'd work with your supervision to identify that. I do want to address one of the previous questions that was thrown out about whether or not we have laptops available for offices, for all the offices that don't have laptops. Wright-Patterson Air Force Base, unfortunately, does not have a store of laptops that we can pass out to all organizations. But what organizations can do is purchase new laptops through the approved supply chain to make sure that they are taking care of their employees. Unfortunately, there is a little bit of lead time with that, but depending on how long we'll need to enforce telework, I suggest organizations identify who needs those now so they can start that process early.
The next questions coming in are for the medical group. Why is the media reporting that the COVID-19 is bigger than the seasonal flu, yet the mortality rate is no worse than the common cold?
For that, if you don't mind, as the commander of the 88th Medical Group, I'd like to turn that question over to our Public Health Emergency Officer, Dr. Ho-Wheeling Lee. And if you don't mind, if you could repeat the question for Dr. Lee.
Why is the media reporting that the COVID-19 is bigger than the seasonal flu, yet has no mortality rate, no worse than the common cold?
Good evening, Team Wright-Pat family. Thank you, Colonel Fauci. I'm Dr. Lee. I'm the Wright-Pat Installation Public Health Emergency Officer. So to answer that question, so at this point in time, the number of patients that have gotten the flu, it is larger than the number of patients that have gotten COVID-19. However, when you talk about the mortality rate, as the data stands now, the mortality rates for the flu is between 0.05 to 0.1%, and for the COVID-19 is about 2 to 3.4%. So when you look at that, that is quite a bit higher than so COVID-19 is much higher than the flu, and it's definitely, so that would be my.
Should we take any medications to help avoid or treat COVID-19?
Currently, there is no vaccine for the COVID-19, nor is there any specific treatment for this virus. So I would recommend that, we do all the things that we do to take good care of ourselves, get enough sleep, eat well, exercise, those things that we could do to boost our immune system.
I am confused on what I should do if I'm not feeling well. Some are saying that if I have symptoms of COVID-19 to self-quarantine for 14 days and not go to the doctor. If that is the case, how would I know if I really have it? And if I do, how do I know I'm in the clear for putting others at risk?
That's a really good question. So, for the COVID-19 the virus, so the more common symptoms is fever, cough, and some people may have shortness of breath. Now, if you are exposed, but to someone who is COVID-19 positive, or you have traveled to high-risk countries, but you don't have any symptoms, then we just ask you to contact our appointment line, and we will give you further directions. Now, if you are, you do develop symptoms, meaning fever, cough, shortness of breath, then you need to seek medical care. So I think so. If you are if you're sick and if you need medical care, then you get it. But if you're exposed and you are but your symptom you do not feel that you need medical care, then you follow the guidelines and self-quarantine.
Are there any precautionary measures people who are not teleworking should take if they have family members in their home who are elderly, pregnant, or have suppressed immune systems?
Could you repeat that question, please?
Sure. Are there any precautionary measures people who are not teleworking should take if they have family members in their home who are elderly, pregnant, or have suppressed immune systems?
I see. So the people are working, but they have member at home that could be at risk. That's the question, correct? Yeah. So I think it is important to, this is why we emphasize, the social distancing, and then if you start not feeling well, then you need to contact your healthcare provider if need to, but I would take the precautions. And if they are at higher risk, the social distancing is a good idea in that case as well.
And the last question, many pregnant women are concerned about having to frequently go to the hospital for medical appointments, lab work and ultrasounds. Having to be screened at the entrance with the general population, are they more at risk? What can they expect going forward with precautions being taken, such as limiting who can go into labor and delivery room and how many visitors are allowed?
I think Colonel Fauci could answer that question. I know it was discussed earlier today, so I'll let him answer that.
Thanks, Dr. Lee. Again, I'm Colonel Fauci, the 88th Medical Group Commander. So I met with our labor and delivery team today to talk specifically about our labor and delivery patients. And the first thing I'd like to tell you is that we've set up our in our perinatal birthing center a phone number for you to call to answer specific questions you have with concerns about your care over this extremely. I mean, this is a special time for you, and we want to make sure that we're taking care of you appropriately. And so that number is 937-257-1938. And that is, again, that's the number to our perinatal birthing center. We have moved away from group sessions where we used to have group classes, and we've moved to one-on-one counseling with our perinatal nurses and our perinatal team for our patients. Currently, right now, as you're screening coming through the facility, we're doing that to protect the facility. So you are not at a greater risk coming through that screening to come and get checked out in our facility. And our perinatal team is actually creating some direction for you with regard to when you need to come in and when you need to be seen, and how we can help you with that care. I want you to know that that team is plugged into the latest national guidance on how to take care of our pregnant patients and their families when it comes to our birthing center. And so they are working very hard to make sure they've put together an abundance amount of information for you to make you feel comfortable to continue to seek your care through our medical center. And we're doing everything we can to make sure that those procedures are in place. And we will be putting together a pamphlet that we can get to Wing Public Affairs and push out. And then also, I encourage you to call the perinatal center and set up a TCON with one of our nurses in order to help walk you through your care in that situation.
Sir, another question on pregnant workers. What about those working in child development centers or contractors? Is there any recommendations that you have from the medical side as to what they should be doing?
Okay, Dr. Lee is going to help us with that care and I believe the question is, when you are at work and you're in a situation, a mission essential area where we are still coming to work and in contact with each other, some of the things that you can do to help prevent the spread of disease.
Thank you. So if you're pregnant and you're concerned, so treat this as like if it's like the flu and the precaution that you need to take. So as someone who's pregnant, your immune system is a little bit lower, so you need to take extra precautions to prevent you from getting the virus. So the social distancing, the preventive measures that we talk about, hand washing and etc., are especially important. And I want to go ahead and clarify a question that was answered earlier, that was asked earlier. I'm confused about what I should do if I'm not feeling well. Some are saying if I have symptoms of COVID-19 to self-quarantine for 14 days and not to go to the doctor. And to answer that, right? So I think that question, if you think you have symptoms of COVID-19, which means fever, cough, shortness of breath, the best thing is to go ahead and call the appointment line, and we will triage that appropriately. So I just want to clarify my earlier answer. And in that case, if you fit the criteria for testing, we will test you, so they will be able to provide the answer whether the person has the infection or not.
Sir, we have a couple of questions on the CDCs. Are there any kind of procedures going forward, thinking about just making CDCs open for mission essential personnel such as cops and medical? Are we going to see anything like that soon?
We're looking very, very closely at that right now. Again, we know how critical child care is to all of our workforce, but in particular to our security forces members, to the medics, and you heard from some of them tonight. There are certain functions on the installation that need to continue, and the loss of those individuals to be home taking care of a child is going to be a huge detriment to the mission. So it's something that we are continuing to evaluate right now with inputs from the units to determine who would be designated as mission essential if we were going to go forward that direction.
And final question on the CDC, sir. Other bases using the CDC for child care, is Wright-Patterson looking to do anything of that sort?
At present, until a decision is made to close the Child Development Centers completely, there's no provision for refunds or credits in that sense.
Thank you. We have just a couple of questions for Colonel Sherman.
Thank you, Bob.
Sir, are deployed airmen being allowed to still come home, or are deployments being extended?
So as of right now, based on the stop movement order, all of our individuals that are deployed, our teams that are helping to take care of that mission downrange, are at a point where they're staying in place. With that being said, it is being continually evaluated based on the best needs of the mission and the best needs of us combating the COVID-19 virus here.
Sir, and we have one final question.
Okay.
Why is the base not closing? Is the base waiting for someone to be diagnosed with COVID-19 before it closes?
Just to really reiterate that point, because I think it's an important message. And one of the things that I really hope that we can gain from this, and if you listen to all of the experts that got a chance to talk to you, it is a very, very deliberate planning process that we go to. It is constantly evaluating the situation that we have at hand, our local atmospherics and the dynamics of our local situation, in close connection with our local communities and our state authorities. All of those go into the factor on what is the point at which we close the installation. And just know that that is constantly a decision loop that we're working through. Obviously, what we want to do is make sure that we're making the decision at the right time, that it's based on the knowledge that by doing that would make an impact to our mission, but also important to be cognizant of that maybe making that decision is absolutely the right thing for all of the people that live and work here. So as of right now, our current operating situation does not dictate the need for us to close the base based on our analysis. With that being said, and as fast as this is rapidly changing, we may need to go into a condition where we actually have to reduce to critical mission essential personnel, base personnel only, and all of those support functions that are needed to keep this base operational and maximizing our telework and technology capacity to continue to get the mission done.
Sir, any final comments?
I think one of the last things that I want to leave is, first off, I want to thank all of our subject matter experts that took the opportunity to share with you tonight. And I want to thank you for helping us out and really helping us get the word out. So thank you for joining us this evening in doing this. The biggest thing that I want to push is that the men and women of the 88th Air Base Wing are truly committed to your health, safety, and livelihood. Everything that they are doing, everything that this amazing team of experts is doing is looking at the situation to make the best decision to protect you and your families. It's our charge. It's what our responsibility is. And please know that we have people that are dedicating every ounce of themselves to doing that. As we continue to go through this, one of the things I want to make sure that we acknowledge is that many of us have never seen anything like this before. and that this COVID-19 virus outbreak and the global pandemic is affecting people in different ways. It's affecting them emotionally, it's affecting them spiritually, it's affecting them physically. And the big thing that I want to make sure that all of you know is that collectively, we have an amazing team of people that are there to help you. It is about being a safety net. So what we need to do for each other is make sure that we're reaching out and checking on each other, whether it's virtually, whether it's via the telephone, or whether it's actually going through our work areas. And we're taking care of those people that may have some anxiety inside, may be suffering from something as they're dealing with changes of their pattern of life, change in what is considered normal for us, all of these things that we are dealing with together. But we have an amazing group of people that are there to help. Everything from our military, family, and life counselors. I would highly encourage you to use the Military One source, and we will make sure that all of these are published. Our chapel has put together some phenomenal podcasts and streaming events to make sure that we're reaching the spiritual needs of our communities. And we have a phenomenal mental health team, mental health community that is there if you need to speak with somebody to help you deal with the situations we're going through. We will make sure that all of those resources are available to you through any of our websites, pages, and platforms, because we want to make sure that you know we've got your back. And we have got a safety net team that is ready to grab you by the hand and pull you up if you are struggling through this, because that's how we take care of each other as airmen. It's how we take care of each other as wingmen. It's how we take care of each other as family. Finally, I'd like to thank you all for joining us this night on this podcast and through this Facebook Live event. It is so critical that we get the information out and that we continue to share. And ultimately, we will get through this together, because foundationally, we are strong, we are resilient, and we are together. And there is no force multiplier that is greater than that. Please, 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 if you have a question, a concern, call our appointment line. Call your supervisor and ask the question, and please make sure that the variety of platforms that we are continuing to update on a daily basis to make sure that you're well informed, make sure that becomes a part of your daily routine so that you are kept up to speed with what is going on here at Wright-Patterson Air Force Base. Again, we care about you all very much. Your health, your safety, and your welfare is our greatest responsibility. On behalf of the 88th Air Base Wing, thank you for joining us tonight. We will get through this, and we will get through it stronger. Thank you.